My name is Corinne Freeman and I'm going to be doing the IV piggyback skill. So first I would prepare and administer all medications according to the 6 rights of medication administration, which are right route, right dose, right time, right patient, right medication, right documentation. Excuse me. And then I'm going to prepare the medication using the 3-check method as well. So I check the physician order and the MAR, and I would check all of the 6 rights, and I would do that again at the patient's bedside, and I would do all of those to make sure that there are no medication errors. Then I'm going to determine if the medication is appropriate for my patient and if I need to reconstitute it. So in this situation, I do need to reconstitute it, and I've got my physician orders here, and it says to administer chloroform 560 milligrams IV piggyback every 8 hours. And you have a reconstituted bottle of chloroform that is 500 milligrams per milliliter. Place in 58 milliliters 0.9 saline, infuse over 45 minutes, and give 4 doses. So I calculated my drop factor as 10, my milliliter per hour 67, and my GTTS per minute as 11. So I'm going to get my piggyback saline solution. I'm going to check to make sure that this is the correct one. I'm going to check for the expiration date, check for any particulates, check for any discoloration, make sure that this is appropriate and safe for my patient. So I need to reconstitute my med. So usually, since I'm reconstituting a med, this would be powder. I don't know if you can see, but this is not powder. I don't have any more powdered medication bottles. I used them all when I did my skills demonstration for injection video, so I apologize. This is all I have, so this is what I'm using. So I got this, I checked this. I'm going to label it with the patient's name, the date, and my initials. Now I'm going to reconstitute my med. So I'm going to put on some gloves, hand hygiene, and then my gloves. And like my order stated, I have a bottle of chloroform that is 500 milligrams per milliliter. So according to this bottle, if I need 500 milligrams, I need to add 5.6 diluent to my medication. So that's what I'm going to do, and I'm going to get the diluent from here. So I'm going to get my syringe. I'm using a 10 cc syringe, so I can draw up 5.6 and get my needle, attach it. I'm going to take an alcohol prep pad and cleanse the top of the medication bottle. Then I'm going to get another one and cleanse the injection port of my solution. So those are all clean. Now, I'm going to get my needle. Uncap it, maintaining sterility. I'm going to draw up 5.6 because, as I stated earlier, that's how much the bottle told me I needed for my diluent. 5.6. Get my thing, inject it. Inject the air, invert it, bring up 5.6 milliliters of the diluent. Tap out any air bubbles. I didn't touch the needle. Inject it into my medication bottle. Okay. Now I'm going to bring up the necessary amount of medication that I need. So bring that up. Check the air. inject it back into the port. And I'm going to dispose of this in a sharps container. And now I'm going to roll this to mix up my medication, and I'm not gonna shake it. Okay, so now this is all reconstituted, my med is ready. So I'm gonna set that aside, and I'm gonna take these off and perform hand hygiene. And then I'm gonna get my secondary tubing, and I'm gonna open that up. Set this aside. Toss that. I'm going to label this with the date and time. Then I'm going to hang my IV piggyback. Take this blue thing off. Take my spike, throw that away. Spike the medication. Make sure that this is clamped shut, which it is. And I'm going to let this come down. And then I'm going to squeeze this until it fills up halfway. Come on, let's go. Okay, then I'm going to prime my alignment and make sure that none of my medication leaks. And we are good to go. Okay, now I'm going to hang this because I'm kind of nervous that this is going to fall. Okay, this is now hung. Now I'm going to perform hand hygiene and put on procedure gloves. Get an alcohol prep pad. Cleanse my port. Toss him. Uncap him. Another alcohol prep pad. Toss him. Cleanse him. Attach these two. Okay. Now that is together, I'm going to slowly unlock this so that my IV piggyback starts to flow, and then I'm going to establish my drop weight, which I said was 10 drops per minute, 67 milliliters per hour, 11 GTTS per minute, and then I'm going to let that infuse. So I would be doing this according to the orders, infuse over 45 minutes and get 4 doses. So that's all good. Once this is empty, I'm going to move my mainline IV back up to its original height and reset the drip rate to what it was originally, and then I would document everything and make sure the patient tolerated well, make sure I left the patient in a comfortable, safe position, and